Hi, I'm Dr. Singhania from Singhania Clinic. I'm going to be talking about allergic rhinitis or chronic runny nose, which is a common problem amongst children. So, what is allergic rhinitis? It's a recurring or persistent runny nose that is common in children and can have long-term implications. I think this is very important. Besides affecting and impacting the child's quality of life, can affect the child in the long term as well. Now, newborns have nasal congestion commonly, and in fact, you'll see little babies sneezing because they can't really clean their nose. And normally, it has no serious health problems. But in children, nasal passages are very tiny and get blocked easily, and this makes breathing difficult. Apart from that, nasal passages are connected to the ears, to the chest, and so it can also affect the other areas of the head. Now, preschool kids start going to school and often get colds and coughs. In fact, 6 times a year is commonly expected. But there is a group of children who have a perennial runny nose, and this can cause long-term consequences. So why do we have a nose? We have a nose because we need to breathe in air, but the air is warmed by our lining of the nose. The air is cleaned by little hair which is lining the nose, and it increases the humidity. So the nose not only helps us to breathe in oxygen, but it cleans the air, it warms the air, and it makes it more humid. We have something called turbinates. So if you look in your nose, you will see things which are popping out, which are covered by spongy mucosa and little hairs called cilia. And the septum is the division between the two nostrils. Now, when the baby or a young child has a chronic cold, what can happen? The mucus discharge from the nose can actually enter the middle ear through the tubes, eustachian tubes, and then this dampens the sound. So the child may not be able to hear very well, and this then affects language and speech. It also affects attention. In fact, many children who I see with ADD will have chronic serous otitis media. Another problem with chronic cold, of course, it blocks nose and it makes breathing difficult at night, but there is something called obstructive sleep apnea, when a child may stop breathing and for a few seconds, and then this affects the child's the next day, so they are more drowsy, or they may not be able to pay attention, they seem tired or irritable. They may also become hyperactive. Often when the child is breathing from the mouth because of the blocked nose, the tongue can fall back, and this can affect teeth and the growth of the maxilla. Now, what are the causes of nasal obstruction? It could be infection, it could be structural abnormalities, allergies, irritants causing swelling of the lining of the mucosa, and very commonly in children, I do see foreign bodies. So when a child comes to me or a chronic cold, I would look for foreign bodies, try to identify allergens and irritants. You look for sinusitis because they're closely attached to the nose, so they can be infected. You look for conjunctivitis, that means, these kids may have itchy eyes. You look for any bronchial irritation like asthma, and less commonly you look for immune deficiencies, ciliary hair, which may be not dysfunction, so the hair may not be beating enough, and some other conditions like cystic fibrosis. But I would also like to check the child's hearing, speech and language, and look for sleep apnea, because all these are very important. So what is the treatment? The main goal is to help the child breathe easily and sleep without disturbance. But also the secondary problems related to blocked nasal passages should be avoided. Now, during an acute cold, we encourage the child to drink lots of fluids. We use nasal saline washes and sprays. A steam bath works well. Sometimes a child will need antihistamines and decongestants. Occasionally, if the child has sleep apnea or has attention problems or speech problems, then we may need to take out the tonsils and the adenoids and help the breathing. Sometimes adhesive nasal strips are also recommended, and these are like stuck on top of the nose to pull it apart and help the child breathe. And prevention, of course, is very important. So dust mites are the commonest allergens. These are very tiny bugs which you cannot see by the eye, which are found amongst carpets and clothes and things. So you need to wash bed sheets with warm water, remove all soft toys and carpets from the child's room, cover the sheets, bed and the pillows with dust mite protection covers, and maintain the room humidity at 40%. Perfumes and smoking in the house should be avoided. Of course, if the child is allergic to pets, that can be avoided. And finally, there's immunotherapy, which is quite a good form of treatment. Is used only in more serious conditions and requires the allergen, which has been identified, to be injected subcutaneously, so the child starts developing resistance to that. If you're seeking help, please visit our website www.singhaniaclinic.com or call us on the number shown below. Thank you.